Can you do this on your knees?
Oh yeah. Hey, welcome back there, future EMTs. Today, we're gonna go over bleeding and shock. So to start, I've got my proper PPE, I've got my gloves and my glasses. Depending on how much blood is there, if it's spurting, I might put on a gown. But whatever PPE is appropriate for the situation. I notice that my patient is bleeding profusely. I'm going to go ahead and apply my direct pressure to that wound. I want to occlude the vessels there, the veins and the arteries. I notice that by pushing my pressure, I'm not stopping the bleeding, so I'm going to go directly to my tourniquet. My partner, my patient Nathan, is cooperative, so Nathan, could you go ahead and put direct pressure on that for me? I'm going to go ahead and take my tourniquet. Nathan, when I tell you to, I'm going to slide this under your hand and you're going to put your hand back on to hold direct pressure, okay? On 3. 1, 2, 3. I'm going to apply my tourniquet approximately 2 inches above the wound. Make that tight, and then using my windlass, I'm going to cinch that down. I notice that the bleeding has stopped. I no longer have that radial pulse. I'm going to note the time that I applied my tourniquet. Then I need to treat my patient. I can see that my patient has lost a lot of blood. I can see they're pale, cool, and clammy. So I'm going to treat them for hypoperfusion, also known as shock. We're going to help Nathan to the ground, lay him flat, cover with a blanket to prevent heat loss. If we are transporting Nathan, we're going to put him directly on our gurney. If we have to stay on scene, I'm going to cover the top of him, and I also need to think about what he's laying on as a barrier to the ground. So if I can provide insulation between my patient and the ground, they won't lose heat to the ground. Then I'm going to apply oxygen, high flow oxygen, at 15 liters a minute. And rapidly transport my patient. Once en route, I'm going to go ahead and take the time needed to dress that wound. That's our bleeding and shock.